Good morning and welcome to the Muscatine County Board of Supervisors meeting for Monday, June 10th, 2019. I'd like to call the meeting to order. The first item of business is to review the agenda.
Move to approve as presented.
Second.
Jeff has moved, Santos has seconded. All those in favor?
Aye.
Now we'll receive comments from the public. Is there anybody who wishes to address the board on a subject that's not already on our agenda? Seeing none, we'll move right along to item number 4, items with County Engineer Keith White. Good morning, sir.
Good morning. First item is a bid opening for a grading project on Iron City Avenue. We'll open these in the order we believe they were received. The first is J.B. Holland Construction, Decorah, Iowa. We have a cashier's check for the bid guarantee. And we'll just be totals as usual, and everybody that bids or asks gets a bid tabulation, but a reminder that unit prices will govern, so we will check them out. Okay, I have a total of $277,441.30. 277,441.30. The next is Miller Trucking and Excavating of Silvis, Illinois. Have an Iowa DOT bid bond. And we have a total of $342,081. $342,081.00. The next is Peterson Contractors, Inc. of Rhinebeck, Iowa. Have an Iowa DOT bid bond. Have a total of $209,936.50. 209,936.50. The next is DeLong Construction of Washington, Iowa. or if you're truly from southern Iowa, Washington, Iowa. Have an Iowa DOT bid bond. Have a total of $225,084.80, 225,084.80. The next is higher construction of Muscatine, Iowa. We have an Iowa DOT bid bond. We have a total of $251,886.95. 251,886.95. And we have Triple B Construction of Wilton, Iowa. The bid bond enclosed. We have a total of $249,292.50. 249,292.50. Looks like we have one more.
Oh. 907.
This was received at 9:07. Time was 9 o'clock. Okay. That's all we had. I will check the map.
Any project updates for us?
Yes, sir. Briefly. On G28, we have heard that Bridgestone has approved all the documents and agreed to sign, but no word back on how long it will take them to sign. And no word back from Hickory Hills on their water main. The grading project was our letting today. Good bids from everybody, we appreciate it. And Bridge 163, which is up on 120th Street, our historic one, we acquired all but one final parcel, which we're looking on numbers on, I believe, some decorative fencing that might be impacted. Iowa had started patching. They've patched on G28. On G28, but they'll finish that likely today. Move on to Wildcat Den, they patched 228 also. Mainline paving will probably not start until 2 weeks from now. Nothing new from Manats on when they might come in for a reclamation project. And our 2 bridges which have been let, and they're actually box culverts replacing bridges, again late summer sort of thing. That's all I have.
I'll do some math and let us know.
Yep.
Thank you, sir.
Thanks.
Item number 5 is items with planning and zoning administrator Eric Furnace. Good morning, Eric.
Good morning. I just have the, for approval or affirmation, this grants to county's grant application. This is the grant that the Muscatine County Board of Health receives every year that provides funding for well testing, well rehabilitation, and plugging. So if you would like to affirm that, and then I will get it sent off. This last year, we were awarded around $30,000. It's kind of crept up the last couple of years, been giving us a little bit more. Just for the viewers out there, we have plenty of money left, with a couple weeks left in this fiscal year yet. We've done 72 well tests under this, so that's pretty good. With the fourth quarter yet to be tabulated, so my goal is generally to get at least 100 wells tested around the county. May not quite get there this year, but in addition to paying for the testing, it also provides administrative costs. It covers the cost of our staff at $60 per test for each test that our staff collects and performs. Then it gives us $60 as well. So it's a good grant to have. It's done a lot of good as far as testing a lot of wells over the years, in addition to providing money to repair damaged wells, plug abandoned wells and cisterns, that type of thing. So we've done 72 well tests, plugged 4 abandoned wells, reconstructed 4 wells and 1 cistern so far this fiscal year. So just seeking your affirmation on submitting this grant on behalf of the Board of Health.
I'll move to approve.
I'll second.
Jeff has moved, Santos has seconded. All those in favor?
Aye.
Folks, get out there and get your wells tested while you still can for this year. Anything else, Eric? Nope. Alrighty. Item number 6 is discussion and possible action authorizing Conservation Director Kurt Weiss to proceed with the new restroom at Discovery Park.
Good morning.
Morning, Kurt.
This is something we've been talking about for a while since the cottage went down at the old barn. But what I'm looking at is a Huff Cut restrooms. This is the same company that we've dealt with on these other pit toilets that we put in. They've also, I've seen some of their projects at Bettendorf has them, Lynn County has them, Des Moines County has new ones, shower houses and restrooms. They're all pleased with them. We're very pleased with this company. They're out of Wisconsin, how they work. But what I'm looking at is they have 2 different types of units. These are 2 stalls on each side, men's and women's with 2 stalls. This is their smaller of the 2 units that they have. I looked at the price of both of them. You know, the larger one would require 2 trucks coming in. It would be a 2-piece, and then they'd have to put it together on site. This one will fit on 1 truck. It's just a 1-piece. A little bit smaller than the bathroom that we currently have at Discovery Park that we built, stick built, but not that much smaller. And the larger one was going to be over $30,000 more, and I just can't justify a little bit more room inside. It's still just a 2-stall bathroom. So I think this is going to be very adequate for that site. Now, we might still be looking at, well, I'm sure we will, bringing in porta potties during the winter because of the playground is there, or eventually maybe putting in a pit style toilet there to offset it, because these are not insulated, not heated, so we will not be running these all winter long. We will drain them out and close them for the winter time, which we do on all our others too.
Kurt, will these be on a septic, or will it be pit, are these pit style?
These will be on the city sewer, and we actually, that be a little bit, the plumber will kind of tell us what our elevation, but they were out there looking at it, don't have a problem. That will have a direct run to the city sewer. Actually, one of their lines come up into the old care facility property, but the care facility and the old cottage used to be on lift stations. And so I wanted to keep away from that. So we will be up high enough where we're locating this bathroom. We will not be on a lift station that will have a direct flow down to the city sewer. So
Very good.
that's good news.
So the cost of the plumbing and the installation will be in addition to the number we've seen on
That's
it?
correct.
Okay.
I'm guessing you're gonna be, total cost for the whole project to be $105,000-$110,000.
And that crane rental, that was their estimate, not necessarily, you'd secure the crane yourself?
We will, well, we kind of thought we'd do that on the first one of our bathrooms, but we didn't, and I actually, like going with them this way. They're bringing in their crane, they've set those bathrooms before, it's working with their staff to set them, so we're not kind of then being the middleman. So we just kind of went with theirs on all the other bathrooms that we've set with their crane service. So we're not getting in between and then having a crane service come in that hasn't set these or worked with their people before.
Okay. And I don't recall the budget that we'd set aside for that, but I think that's well within what we were planning for that.
Yeah.
Sherry, I don't see Sherry here, but that's correct, Nancy?
Yes, we have,
Yeah.
Money
I'd
to
move for
cover
its
this.
approval.
Okay.
I second.
Jeff's moved, Scott has seconded. Any further discussion? All those in favor?
Aye.
Those opposed? Thank you.
We'll get it on order and hopefully have it installed by the middle of August.
Wonderful.
Perfect.
Okay. Item number 7 is a presentation on the July 1st, 2019 health and dental renewals and related topics with Devon Harper from Walmart. Good morning.
good morning.
Thank you.
So good morning, everyone. Thank you for having me in. I'm going to be reviewing the renewal, and with the renewal, I have an analysis when I went through the information to give you some updates on what you've been doing, how you've been working in the past. We'll look at the rates, we'll look at the alternates, because there's some changes that were made. And then I have a summary of the annual report. I don't want to spend too much of your time. I made a summary so that it'll go over what's driving your cost increase this year. We'll talk about some of the large claims, and then talk about the recommendations and the changes that were made to the plans. And then we'll also look at some specialty, blue distinction programs, some specialty care, total care, go through that with you and just give you some information on that. And then some additional updates, and then I have Julie Enga with me to talk about the wellness programs that Wellmark offers.
Welcome, Julie.
Thank you.
If you turn behind tab 1, this is the renewal worksheet that I put together. This is 4 years worth of data. The most current period for the July 1st, 2019 renewal is on the right-hand side. And as we go through this, you can see that the time period is run from December 1st through November 30th, so it's on the same time frames for every year, so it's a apples to apples comparison when you're looking at the different years. And as far as enrollment, there was no change to enrollment for active employees and retirees on the plan for this year, so you're at 188. Health claims decreased based on, these are charges, so these are not allowed charges. This is what claims were submitted to Wellmark and what the total charges were. When we look at the annual report, that's going to be based on allowed amounts. So the numbers are going to be a little bit different. But based on this, we did receive a decrease of 11%. Under that, the pharmacy benefit increased over 65%. So you can see that $1.5 million in health claims, $615,000 for pharmacy claims, totaled $2.1 million in total claims. And then when we remove the stop loss claims, and your stop loss level is $75,000, you had $283,633 in claims over that stop loss level. That brings that down to 1.8 million, which is a 0.5% decrease from the prior period. And when the underwriter reviewed this, they put a factor together to see how you're going to complete through the end of June. And with that information, they're expecting you to complete at $1.9 million. And that's about a 1.5% increase, a little bit over a 1.5% increase. And then when you look at that next line below that, those are claims per employee per month charge. And for this current period, you're at $850.46. The prior period was $836. So you can see that your employee cost is going up. And below that then are the fixed fees. This is your stop loss fees. These are the administrative fees and network access fees. And the network access fees are arrangements with other blue card plans for when you have members having service outside of Iowa. So if somebody would go to Mayo, they would use the Blue Cross Blue Shield network of Minnesota. Then pharmacy fee, that's a pass-through fee that pays our PBM to help maintain the network and the pharmacy benefit. So overall, fixed fees are going up 6.57%.
Driven mostly by the stop loss.
Most of it was stop loss. And when you look at the stop loss levels the last couple of years, you've been over 200,000 in stop loss claims. And it's a little bit higher than what we would expect. So that's just helping offset that. And when we look at the next section, you can see that we have some additional ongoing costs that we're going to experience. But right now, when you look at your ag review, so basically your aggregate and your stop loss levels, you're running at over 100%. And they're expecting you to, the underwriter's expecting you to complete at a little over 100%. So it's a little bit higher than what we want you to be, especially when it's regarding the stop loss. So with that increase in your claims, we're giving you that increase in the stop loss. Total increase to estimated suggested rates is 9%, so that's all your estimate or your expected claims and all the fixed fees. And when you look at the large claims underneath there, the largest claimant was over $208,000. They're on a chemotherapy drug, and they're expecting to have ongoing claims between $100,000 and $250,000 in this next year. The second largest member at $167,000 has been turned off the plan. The third one at $132,644 is another chemotherapy drug. Expected to have ongoing claims between $100,000 and $250,000 next year. And then the next two are claims under $20,000, but they're expected to have ongoing claims between $50,000 and $100,000.
Those are all individual claims.
Those are all individual claimants. So that's what we're expecting to see ongoing next year. That doesn't take into account anybody that could come back, that could happen to have something ongoing. As far as demographics, your group, as far as employees and members, demographics are higher than what our Wellmark book of business is. You have 50% of your employees over the age of 45, and mostly male at 57%. So that demographic isn't helping as far as when we're looking at the overall rating. And for a group of your size, 60% of the weighting is based on your actual claims. So the underwriter looks at the current period's claims and the prior period's claims, and they base 60% of the renewal on that. The other 40% is based on your demographics, so your age, sex, location, things like that. So your demographics is not helping in this situation, and plus your large claims aren't helping either. And then as far as the analysis for your large claims. In the current year, you have 48 claims over $10,000, with 3 claims over $75,000. The prior period, you had 54 claims over 10,000 and 3 over 75,000. And what we expect for a group of your size, we expect 37 members to have claims over 10,000 and 3 over that 75,000. So you're running higher than expected overall on large claimants. Then the final renewal decision, expected claims increasing 9.48%. That's where we're just seeing overall claims have increased for your book, or for your members, about 9.5%. Admin fees and network access fees going up 2.5%. The stop loss, the individual stop loss and the aggregate stop loss is 8.22%. And then when you group that all together, the overall increase is the 9.01%. The dental decreased 10%, and there's a new 24-month rate guarantee on that, but we did make some changes, so we'll look at that one, at the rates here in just a minute. And just some additional information, Wellmark's overall trend as far as our book of business is running just under 8%. So if you look at that and look at how you're doing, you're running just higher than our trend increase at 9% compared to that 8%. And then the weighting there tells you how you're weighted. And then just some things that impact medical and pharmacy trend. Price increases, you know, prices always go up. You go to the grocery store today and you see prices go up no matter what. And it's no different in the medical industry. Utilization is increasing. We're seeing more services for different things. New technology, pharmacy, you can see that in the pharmacy business. You can see that prices are increasing with drug costs. And then federal state mandates. You would be in a county, a public body, you have to follow those state mandates. And then some information on specialty drugs. Our projected trend for specialty drugs is in the next 3 to 5 years, 4% annual trend for traditional drugs. So your normal prescriptions that you go to the pharmacy to get is about 4%, but specialty drugs, we're expecting 15% annual increase for those. And those are the drugs that you see the commercials on TV for, typically the Humira, the Enbrel, and they're usually pretty high dollar drugs. And when we get into the reporting, we'll look at a little bit more what the cost is for the county. And we're predicting that specialty drugs will be 50% of your pharmacy spend next year.
I'm gonna ask a question, maybe you'll talk about it later, but I know at one point in the past, we talked about preventative checkups and things like that in our utilization. Are we gonna talk about those later, or if we can see if we've made any impacts on that?
Yeah, and I think you have. You don't have a lot of people that haven't been to the doctor at least once. I don't have specific routine information, and I can get that for you. But I do have a report that shows in the office that routine services is in the top 5, I think. So your members are doing a good job going to the doctor, but there's still, I think, 32 people that hadn't gone to a doctor at all. So that's not terrible, because when you think about it, you know, if you're in your early 20s, your mid-20s, you go for your routine exam and the doctor doesn't find anything wrong, you don't necessarily have to go back the next year. They may tell you to come back in 2 years for your routine exam. So you're going to have a few that fall into that category. But I think for the most part, seeing that routine diagnosis in the office, that most of the people are getting the routine exams done. But I can provide you with some additional reporting on that too.
Thank you.
Yes.
Just a question real quick. On your drug claims where we went up so high, do we, as Wellmark, do we individually go out and bid out versus different pharmaceutical companies that will help us, like
For like
CVS or you know, Express Scripts or different groups that would help us, give us more discounts?
So today we work with CVS Caremark for our pharmacy benefit manager. And we do a market check every 2 to 3 years to see who does the best job. We also have a lot of guarantees in place. And when you look at specialty drugs, as a self-funded employer, you if somebody is on a specialty drug, there's usually rebates involved. And any rebates that we receive are passed on directly to you as a self-funded employer. So we don't hold any of those as complete pass-through. We have a contract with CVS that they have to guarantee that if there's a drug that has a rebate on it, even if they haven't been paid, they have to pay us. And so that we can pass that on to our self-funded employers. So we have a lot of things in place to ensure that we're getting the best deal for you as our employee.
I just wanna make sure that we are and how we're managing that, making sure that we're
Yeah.
double checking ourselves.
Oh, yeah, and it's a big deal because there's a lot of money involved. We also have our own pharmacy and therapeutics committee that review all the drugs that come on, that are approved by FDA. And we look at their efficacy, see if it's, what criteria it needs to be met. Do they need to go through step therapy? Do they need to be, have some quantity limits to it? So we have a lot of things in place to ensure that the drugs that are out there on the formulary that you utilize are the best drugs for you and are at the lowest level. The ones that aren't as good or are more costly, maybe at the higher tiers. So we have things in place to ensure that members are getting the best drug for the best cost.
So, with that being said, that being the largest increase of all of the numbers, I mean, was that due back to what you just came down below that, all those chemo and cancers? I mean,
The chemo drugs are very expensive.
but
And
did they just come in last year?
And they've been, as far as the drugs, just,
No, did they just all of a sudden be charged as of last year? Because, I mean, only last year was the increase of 38% to 65%.
I would have to look at the members to see if they are new members to the large.
That's why I didn't know if there was a different drug or something that,
And
I mean, what caused that
Got
increase?
sick last year.
Yeah,
It's
it
very
could have been something like,
possible.
and that may be, I was just interested
Yeah.
to see why it went up.
There's new specialty drugs coming out all the time. There's one that just came up for genome testing, and it's $2 million for the drug. It has not even been reviewed by our pharmacy and therapeutics committee yet because it just came out. They'll review that to see if it's even gonna be covered or how it will be covered. So there's things like that are constantly being sent out by the pharmaceutical drugs companies, and they come at a cost. I mean, they're good drugs because if you look at the hepatitis C medication, they have over a 90% cure rate. So that's good, but it comes at a cost because they usually run about $85,000 for a 90-day treatment supply. So there's expenses out there, and unfortunately, you're getting hit with some of those members that are utilizing the specialty drugs. And a couple of changes that we made to the specialty drug program for Muscatine County is one, we moved all of those specialty medications under the pharmacy benefit. Some of those were covered under the health benefits previously. So by doing this, it's ensuring that we've got that pharmacy management, utilization management in place, that they're being reviewed as far as how they're on the tier levels and what the member would pay for those services, and also the utilization management under the pharmacy. The other one is the specialty copay card program. So, an example, when somebody gets a specialty drug, today, if they were on Plan A, they would pay probably $30 for that prescription, even though it may cost $5,000 or $6,000. So they're paying a $30 copay. We changed the benefit to, for 7-1, that on specialty drugs, it's gonna be a $100 copay, which still, it's reasonable, but when you look at the overall picture, it's still just a very small portion of it. So with the copay card program, what a member would do is they would go to the pharmacy, or a specialty drug, I guess it's all mail order, they're gonna have their doctor submit the claim to CVS, and they would pay a $100 copay. Now, on the back end, the pharmaceutical companies provide copay card programs to where sometimes the members don't pay anything. So they are incenting members to come use their product, and in the meantime, they're giving them a program to where they don't have to pay a copay at all. So what we were doing, we couldn't capture that information before, so we were artificially inflating the out-of-pocket maximum, showing that they actually paid $100 when they actually did not. So with the specialty copay card program, we can capture that information from the copay card that they're getting from the pharmaceutical company, showing that they didn't pay anything. And so that now their out-of-pocket maximum will not be inflated. Now, it's not a huge impact to the way your plans are set up, but if you ever look at having a high deductible health plan at some point, that's where you're gonna see a big difference, because some members could meet their out-of-pocket maximum with one claim, and then have everything paid at 100% after that. So when they're not paying for that drug, then this doesn't get artificially inflated, because they're actually not paying anything for a prescription for those specialty drugs. So that's something that's been put in place for 7/1, so it'll actually show what the member paid for that prescription. So we have things in place to help offset some of those costs, but I don't know that it's going to impact in the long run, because as long as the pharmaceutical companies continue to charge those high prices, there's not a lot of control we have over that.
Thank you.
So with the plan changes, the next 3 pages are the renewal rates. If you flip behind the first blue page, it'll have what was actually purchased for 7/1. And the ones that were purchased have the yellow writing at the top, or the yellow highlighted. So if you go behind the blue page, so you have 3 plans. Plan A is your 400 single 800 family deductible. And these changes were made to all 3 plans. So what we did, the one accidental dental coverage under the health, so this is if somebody is in an accident and falls or hits their mouth and breaks their teeth or something along that line, our standard coverage is to cover that within 12 months. Today, your plan has 72, if initiated in 72 hours and completed in 30 days. A lot of times it takes a lot longer for that swelling to go down. So our standard is to cover it within 12 months, so we moved it to the 12 months. We talked about the specialty drugs. We moved all of them under the RX plan, and then we added the specialty copay card program. We also removed common accident deductible. And do you know what common accident deductible is?
Yeah, we talked about it.
Okay, okay. So that's been removed, and well-marked to well-marked deductible out-of-pocket maximum carryover has been removed on the plans. Any questions on that? And then we added the $100 specialty copay card, or specialty drug copay. Behind those rate sheets, just in front of the blue one, I did put together some information on different stop-loss levels, if you wanted to look and see what that would be. And today it's at 75,000, so it's just be in front of the blue sheet. Did everybody find it?
For us, I think it's not,
Yeah,
maybe
it's,
1 or 2 in front of the blue
it's
sheet.
2 in front, yep.
Okay.
It's like about 6 pages in, I'm gonna say, maybe tab 1.
So this is just a way for you to see if,
Your stones. Yeah, it's after the first blue sheet.
After the first blue sheet.
After
Yeah, keep
those,
going.
after
Keep
those.
going.
One more.
There you go.
There, okay, I got it.
Yep, you got it.
Right before the second blue sheet.
Yeah.
Okay, I got it.
So, $85,000, to increase it to the $85,000. Overall savings, when you take into account what your additional cost would be to cover your members up to 85,000, would only be $6,800. To increase it to 100,000, your overall, savings would be $3,200. So there's not a lot of savings at this point, so, I would say that at $75,000, you're doing well, but we'll continue to look at this on an annual basis to see if that's something that you wanna look at. But I wanted to give that information to you just to see how you're doing at your current level. Then behind the next blue tab are the dental rates. The first dental page is your renewal. And then if you go 2 more pages behind that, that's going to be what the new dental plan is. The only change to that is you're increasing the benefit period maximum to $2,000. It was $1,000. So members can go to the dentist now and have covered services up to $2,000 per year per member. So it's just a cap, we've increased the cap on that up to $2,000. Nothing else has changed on the plan. This is a 2-year rate guarantee, so this is good through 2021. Any questions on that?
Is the dental, is there like a high, medium, and a low for those to be able to request, or is it just Signal and Family and that's all they get?
That's all.
That's just the one plan.
For our health and dental, all we have is single and family tiers.
I mean, you split that out by 4, if you wanted to look at 4-way rates, we could, but usually when that happens, the family plan gets the brunt of it, so that the family plan would go up quite a bit compared to the single plan would go down. So it's something we can look at.
And we've looked at that every couple of years. We've taken a look at that, and really we've come to the same conclusion every time that the employees that would be most impacted in terms of additional cost are some of our people who are in our lower salary grades. And so the board has opted not to implement those.
And just out of maybe question, I mean, have we ever like looked at Delta Dental or other dental providers besides just Wellmark?
We used to have Delta Dental.
Is it easier just to keep it bulked in with Wellmark? I mean, I know this is what you guys are providing, so it's not something you guys want to hear, but I'm still gonna ask.
No, that's fine, that's fine.
Certainly from my perspective, it's probably easier to have that all tied into one and not have to go through 2 separate renewals. But that's something we can certainly look at in the future if
I mean, it really
Numbers
just,
want
it's
to do
what the
that.
cost is, it's not I mean, obviously the dental is not a large hitter as much as the actual family plans that we're seeing right now, but it's just a question why we bulk it all together versus separating it. Sometimes you'll see a lot of providers that will do health insurance and then they'll do dental and then vision. There'll be 3 different providers. Rarely do you see it, that I see a dental and a health insurance combined. But that's fine, just a question. Maybe we can look at that for you future-wise.
I can say the county has done all of it through Wellmark, even back when we had Delta Dental. It's been done through Wellmark since before I got here. There's been a couple of times that we have looked at other providers or third-party administrators, and have come to the conclusion each time we've done that with my mind's gone, the reduction in cost that we get, because of the negotiations Wellmark has made with providers, that this was still
Just look at-
most cost effective for us.
Okay, that's good.
If you go behind tab 2 then, I have a couple of pages here that I just summarized the annual report. I didn't want to take up your time to go through the entire report, so these are just a few of the things that I highlighted. So, and I put the page on the report that it's correlated to so that you can match it up. But it's total claims on the report, and remember this report is paid claims or allowed charges. And total claims paid in the current period, $2.1 million. Medical is $1.5 million. Pharmacy is $616,000. This is an increase of about 14% from the prior period. Medical paid amount has been fairly flat, while pharmacy paid amounts increased over 64%. And total paid per member per year is $5,310, which is almost 11% higher than it was in the prior period. And this is per belly button. The previous report was employee, so this is per belly button on the plan. And then the network performance, which is on page 6, you're receiving 50% provider savings due to our contracts with doctors and hospitals, and that equates to just under $2 million. And your members are staying within the network at just under 100%. I think we have a hard time finding a provider that's not in the network. And then the next part, the claims paid by range, is on page 7 of the report. Over 57% of the total claims paid were under the stop loss level, and were between $5,000 and $50,000. That is 83 of your members fell into that category, so well over half fell into that category. Whereas 23.3% of your total claims paid were over the stop loss level between $100,000 and $500,000, and 3 members fell into that range. And Muscatine County paid 91% of the claims versus just under 9% that the employee paid out of pocket. And when you compare that to the Wellmark benchmark, so other employer groups that we work with, the employer pays just under 85%, and the employee pays a little bit over 15%. So your plan still is on the richer side when you look at our benchmark. And then as far as spend overview, allowed charges per member per year trend by place of service compared to prior periods. So inpatient has increased over 10% in this current period. And when you look at the last 3 periods, it's over 90%. So that's where your main costs are coming from. And the last 3 periods are inpatient services. And that's what's driving your stop loss claims. Because typically when somebody's inpatient, you have large payments involved. Outpatient is decreased from the current period, down to decreased by 6%. And when you look at 3 periods, there was only a 1% increase, so that's been relatively flat in those 3 periods. Office has increased 7% in the current period, but when you look at the 3 periods together, it's gone down over 24%. The other category, which makes up ambulance services, skilled nursing, home health care, fall into that category, so it's only a small amount. That did increase 21% and increased 21% in the last 3 periods. Pharmacy we've talked about quite a bit. It's increased 53% in the current period, but over the last 3 years, it's increased 94%. Outpatient overall is the most costly. More services are done outpatient today than anywhere else. So you have a lot more volume when you go to the outpatient for services. And then employees and spouses are the most costly by relationship, and employees have been the most costly in the current and the prior period. On the next page, as far as diagnosis categories that's driving your cost, bones, muscles, ligament is prominent in the inpatient and outpatient services. This category is the largest for Wellmark overall because it encompasses not just your knee and hip, but it also encompasses younger people that go out on the weekends and do yard work, strain their back, have knee problems when they play football, and they think they can do the things that they used to do when they were teenagers. So it encompasses a lot of people, and that is our largest category. And as far as your inpatient, the bones, muscles, falls numbers too, and so does your outpatient. The number one for inpatient category are your benign cancerous tumors. And then the third one is heart vessels. For outpatient diagnosis categories, injuries and poisonings, which usually injuries are the largest category there, followed by bones, muscles, drug dependency, other, and then skin, nail, and hair. Then your office, blood, spleen is the top, and then your routine is number two. So your members are going to the office for routine services, which is good. We want to see that. But like I said, I'll get you some additional information on that. And then you have a lot of family plans, so the nose, throat, and lungs will fall into this, the third category, other, and then birth defects. Emergency room costs have been running higher than the benchmark 3 out of the 4 periods. And this is an area that member education would be good because there's a lot of alternatives. We have the Be Well 24/7 that members can utilize. We have the Doctor on Demand, which are the virtual visits that members can utilize. But if somebody is sick or is having chest pain, we do want them to go to the emergency room. But there's some ways that they can offset if they're not sure if they should go or not. So there's a lot of things in place, and we have information available to the members that can help educate them on those things. Then on the next page looks at pharmacy. And non-specialty pharmacy generic utilization is just under the benchmark. So you are running at 86.7%, and the benchmark is 87.4%. Specialty drug utilization costs continue to increase. In the current period, you have 31 specialty prescriptions were purchased compared to 12 in the prior period. Allowed charge on average is $10,735 per prescription. And members between that 56 and 64 are utilizing the most prescriptions and also the most, are being charged the most for allowed charges. The specialty drugs make up 53.8% of your pharmacy spend, so you're actually running higher than what we predict. And diabetic drugs make up 12.2% of your pharmacy spend. And then overall high cost claimants, you have 3 large claimants over 50,000 that are due to cancers, and the specialty drugs are the main drivers to that. Any questions on that? I'll let you look at the annual report. If you have any questions regarding the annual report, let Nancy know, and I'll be happy to follow up with her with any additional information. We're going to skip to tab 4. There's a couple of things to keep time in mind. And I wanted to talk about Blue Distinction Specialty Care. So Blue Distinction Specialty Care focuses on our facilities, so hospitals. And what it is, it's a program that these facilities have to meet certain criteria in order to get a Blue Distinction Center designation. And if you turn over to page 4, the Blue Distinction Specialty Care, so facilities receive one of 2 designations. So they have the Blue Distinction Centers, which is, they're recognized by their expertise in that specialty care, or Blue Distinction Centers Plus, which is recognized for that specialty care, but also having lower costs. And there's 7 different impact areas there on page 5. So it focuses on facilities that do well in bariatric surgery, cardiac care, knee and hip replacement, complex and rare cancers, maternity care, spine care, and also transplants. And the Blue Distinction Centers, if you flip over to page 7, they're not just in Iowa, they're all over the United States. We work with other Blue Cross and Blue Shield plans to make sure that members have access to the best hospitals. And if you flip over next to page 9, you can see that for bariatric surgery, overall savings is 13% by members utilizing a Blue Distinction Center or Blue Distinction Plus Center. The next page then, it looks at cardiac care. And there's a 23% overall savings by utilizing one of these centers. On page 13, knee and hip replacement, there's a 24% overall savings. Page 15, for maternity care, there's a 25% overall savings. Page 17, there's a 22% savings for spine surgery. And then on 19, for transplants, there's a 20% overall savings. So there's a couple of different ways that we can promote this. First would be to educate members that these are available, that if I was going to have surgery in that area, I'd want to go to the best hospital that had the least complication rate or readmission rate. So it would be for their interests to go to one of these facilities. Another way is we could reward the member for utilizing them by incenting them, maybe waive the deductible for a hospital visit for them utilizing the Blue Distinction Center. The other one would be to waive the deductible and then provide travel benefit. That if they had to travel more than 150 miles for a service or for a transplant, they would get a travel benefit of maybe $100 a day to help offset some of those hotel costs and other costs while they're having that service done. And you would see that more likely in a transplant situation or one of the rare cancer situations, because there's facilities that are fairly close by. The University of Iowa is a facility that does a few things, and I'll have a small list here that I can go over with you in just a minute. But it's a way just to get members incented to use better facilities that have better outcomes. The last one, which I would not recommend for you at this point, would be to restrict them to Blue Distinction Centers. And if they go away from the Blue Distinction Center, they wouldn't have coverage. I can tell you that Wellmark, as employees of Wellmark, we have to use a Blue Distinction Center, or else it's not covered. So we are already at that limit, but it's something that maybe to look at as an option to help reduce costs going forward.
In your list on page 7 for your specialty locations, can you expand that to where we can see the members can see what's actually close by versus
and
you can share that, we can share that with staff?
And there's, if you go out to wellmark.com, you can go to the provider directory, provider list, and go to Blue Distinction Centers, and it'll pull up the area. I do have a couple of them written down here. The University of Iowa is a cardiac care. So is Mercy in Iowa City, and so is St. Luke's in Cedar Rapids. Knee and hip, Genesis, Trinity, and the University of Iowa are all Blue Distinction Centers. But yeah, I can get some information for you.
Something that would be local for,
Yep.
I mean, obviously the biggest question from somebody here is there anything here for us in Muscatine
Right.
or in the Quad Cities?
Yep, I can get a list for you for those, but yeah, I think the education is key when you look at that. Just making sure the members, I bet you members don't even know what a Blue Distinction Center is.
I never heard of it.
And I would think members would be, speaking for myself here, is anytime I'd go to a doctor or a hospital, I wanna go to somebody that's got the best outcomes.
Right.
And recognized as such, because you just don't wanna risk it, so.
So, yeah, we can definitely increase awareness and provide some information on that. If you turn over the end of that presentation, you'll see a slide that says population health, Muscatine County employees. So, it looks like this. Everybody there? It's right after that presentation. So I think you might be, go one more.
One more,
page.
Doug, right there, one more.
There you go. So this is what we call a population health. This is specific to Muscatine County employees, so this is everyone covered under the plan. And we put together a continuum basically to show where your population lies and what the costs are for those members. So just an example, healthy members that fall into that healthy category, so over 30% of the members fall into that category, and only 6.6 of your overall costs are caused from those healthy members. If you go up a little bit further, you get into the minor chronic. You can see that 25.5% of your membership falls into that category, and over 18% of the costs fall into that category. Look into the single chronic, over 18% of the members are in that category, and then over 30% of the costs. And then the double chronic, and the double chronic typically is someone with diabetes and has high blood pressure. They typically are those two diagnosis as far as the double chronic. You can see that 11% of your members fall into that category, and over 31% of the costs fall into that category. And then you look at your triple chronic and then your malignancies and catastrophic. So when we look at this, there's not a lot of control we have over those high dollar, those triple chronic malignancies, catastrophic. They happen. I mean, we'd like to be able to prevent somebody from getting cancer, but there's really not any way for us to stop somebody from getting breast cancer or colon cancer or that type of thing. It happens. But when you start looking at the double chronic and below, there are things in place that can help mitigate either keeping the member healthy or keep them from getting, maybe getting better. So type 2 diabetic, they lose weight or eat better. There's some ways that we can help reduce that risk for that person that falls into that category. And this next area, if you turn over to the next page on the back of that, so you have 423 members, health plan members, so every belly button on the plan. When this report was pulled, 32 non-users, so 32 members did not have any claims at all. So they didn't get a prescription, they didn't go to the doctor for anything. And everybody is pretty located in Iowa. So we can say that we can attribute 72% of your membership to a primary care type doctor. So 72% of your population has a primary care doctor. When we look at the next area, we're going to talk about Blue Distinction Total Care, which is a way of looking at how to pay providers. So today when you go to the doctor's office, they get paid a copay every time you walk in the door. So they get paid that copay. There's no incentive for them to keep you out of the office. With this program, what they're doing is it's a value-based program to where if they can get you healthier or maintain your health, they get an incentive. So they get paid some additional dollars. They have to meet certain goals, they have to meet certain criteria, and if they meet that criteria, then they get paid additional money. And the way it works, if you flip over to page 4, on the right-hand side, it has Blue Distinction Total Care definition. So basically it looks at patient care through a value-based system. We have accountable care organizations here in Iowa, ACOs. We work with 18, I think, different ones. Unity Point, we have Genesis, we have University of Iowa. There's a lot of different ACOs that we work with here in the state of Iowa. If you're traveling outside of the state of Iowa, there is also value-based plans, and they work with patient-centered medical homes there. When you look, I'm going to have you flip over to page 7. So there's 6 requirements of the program. Again, the member has to have a primary care type doctor. It can't be a specialist. It has to be a primary care doctor. If they haven't seen a primary care doctor in the last, I think it's 18 months, then they're not attributed to anything. If they go to see a primary care doctor, then they would become attributable. So we see that number vary, so members drop on and drop off, depending on when they've seen a primary care type doctor. But we use reporting, so how we do it, Wellmark has all the information. We have pharmacy information, we have all the medical information, We know if somebody goes to the University of Iowa to the emergency room, but their primary care is through Unity Point, they don't typically talk, they don't let each other know what's going on, but we have the data that we can gather it together and send it to the primary care doctor and let them know, this member was in the ER last week. You can reach out to them, make sure everything's going okay. Because a lot of times you don't follow up with your primary care doctor after some certain services. We also have all the pharmacy information, so if you have a specialist and a primary care, they don't necessarily know what drugs you're being prescribed. Pharmacy usually does a pretty good job, but if you go to a different pharmacy, you don't always know. So this is one way that we gather all that information and send it to that primary care doctor so that they can be proactive in helping with your health care rather than reactive. And with this, as a self-funded employer, you pay your own claims. So with that, we would ask that you help fund this if it's something that you are interested in doing. Wellmark's been doing this since 2014 with our fully insured book of business. And we've seen savings overall. And turn to page 10. For the state of Iowa, we've seen 22% reduction in hospital readmissions. Over 13,000 more members are working with primary care doctors. And over 360,000 members are attributed. So this is a way that we've done since, we're on the hook for our fully insured book of business to keeping members healthy and to keep claim costs down, that we've found a way to help reduce those costs. And you as a self-funded employer, we've given you the option that if you want to participate in this program, you can do that, but there is an additional cost for you to do that. And if you flip over after the presentation, it'll be the last page before tab 5. This has the funding. So we estimate monthly member attribution, so those members that have a primary care doctor, between 244 to 366. And that monthly funding is $4.24 per member. And the estimated monthly fund would range between $1,042 to $1,563. And then it has the annual funding there. So this is available to you if it's something that you're interested in. I'm starting to see more of our self-funded employers get on this because it is a way to help look at long-term cost reduction. I don't see that it's not going to be a reduction in the first year or two, just because the doctors are going to be reaching out to members, getting them in the doctor's office, making sure they're getting the tests done that they need for those chronic conditions they had, and being proactive in their health care rather than, like I said, reactive on later when they actually get sick and they need additional help. But this is a value-based program. Medicare's been paying providers on this level in the past, and they have today. But it's something to think about, that we do believe that this is what's one way to help mitigate some of the increase in costs going forward. Wanted to get this in front of you to have you look at it. What questions do you have for me?
I'm trying to understand a little bit about how, some of exactly how it works. So you're saying that there's incentive payments to these groups, these ACOs or whatever, that would encourage them to reach out to the member or to other providers?
It goes to the member. What we do is we gather the reporting based on who is participating in the plan. We send the information to their primary care doctor. And actually, we've seen a lot of the primary care doctors add in another person that goes through the reporting, so it helps them make the best outreach to the members. But it's the doctor's office that's reaching out to the members. We're not doing it, you're not doing it. I think it comes better. Members take it better when their doctor is reaching out to them. They might get a phone call, hey, did you get this test done? Or you need to come in for an exam, that type of thing. So they're gonna get outreach from their primary care doctor.
So right now, they don't have blue distinction total care, correct?
They have, no, you don't have Blue Distinction Total Care today. Because since you're a self-funded employer, you pay your own claims, and that's not part of the program.
So when you're saying your monthly estimated member attribution is 244 to 366, that is on top of what they're paying currently,
Correct.
and this will be an added
Cost to us.
cost
Yeah.
to each member, or
No, to us.
To the county.
So we'd be paying $4.25 basically.
Per member per month.
Person covered.
Yep.
Not employee, so it'd be more.
Okay.
And then the anticipated, so you say it's $18,000 a year cost.
That would be the most, yeah.
And then what you've seen on typical recovery from this program is about a 10%, was that what I read back there? They said lower cost overall?
Overall, as you get into the program, the first couple of years, you're not going to see the savings because members are hopefully going to the doctor and getting them back on track or helping to improve their health. But in the long run, we would expect to see savings. You can't take into account those catastrophic claimants, that's still gonna happen. But overall, your population should be getting better. And these are estimate funding, so I don't wanna say that the $4.27 is a hard number, because they're gonna review that based on current information. So it could vary depending on what's going on, so, but I would provide you with solid numbers before you would sign anything. Okay? And I will, stop there and let Julie
So 20 grand to save.
go over the wellness.
Thanks, Yvonne. So we are focusing on, I think all of your information is, I know this is quite a book, but tab 6. So I am gonna be focusing on that area for this discussion. As Devon said, my name is Julie and I'm part of Wellmark's Employer Consulting and Wellbeing team. So at Wellmark, we have a staff of 6 individuals that are collaborating with your medical plan account managers on groups and also offering a variety of services based upon the needs that we identify. And so if you think about Wellmark and the bundling question and whether we should pair it or not, I always like to set the stage. At Wellmark, we have more than 2 million members. Right now, we have 800,000 that have access to some type of wellness services. We've been offering wellness and consulting services for more than 11 years. So we understood that there was a need from our employer groups and then also our fully insured members for wellness services. And so we decided to fill that need more than 11 years ago. From perspective of what Wellmark's been doing, so I was originally hired there 20 years ago. We've been offering wellness programs for our employees for more than 20 years. So I know when we talk about wellness, there's lots of questions. I wanted to level set, so under behind 6, I just want to tell you a little bit about what's going on in the wellness industry. When you think about employer groups like Muscatine County, what we know is on average 68% of employer groups offer some type of wellness program to their employees. When we're talking about a large employer group, it's closer, it's 85%, whereas a smaller employer group, only about 50% are offering. But wellness is a conversation that comes up quite a bit. So on average, we see most or a lot of employer groups offering some type of wellness. Again, it's about 68%. Why employer groups offer wellness, which is the next slide, has been an interesting trend. When I first started in wellness, what we heard a lot was, what's my return on investment? I'm offering wellness to lower my healthcare costs. The tide is changing a little bit, not only because the research to back that up there's so many variables on wellness in a work site that employer groups and research have shown that they can't demonstrate a return on investment, a one-to-one return. Employer groups most often, or now what we're seeing when we talk about wellness and we get questions is, it is something that they want to offer to be an employer of choice, to support a good workplace culture, attract and retain top talent. So why employer groups are offering it has been a shift over the course of the last 5 to 10 years. This was just updated. I just saw some new research and it is very much going to this trend. So return on investment and making sure we're managing our members' health is still important, because you know, as you've heard and you've seen, there's lots of conditions in the workplace that can impact your costs, your direct costs, but also costs that we might see from a productivity, energy level in the workplace. What your employees want, so that's going to the next slide, is changing a little bit. Traditional wellness programs started to be focused on eating right and exercise. And I have to tell you, I'm a dietitian. I went right into employee wellness, and I was focused on helping employees eat right. And that is where we saw many of the traditional wellness programs. But what we're seeing, and the shift is, what individuals or employees coming into the workplace want is shifting. They do want to understand eating right and exercise when you talk about wellness programs, but there's also an incredible need for other areas of well-being, including financial, community, and social. So you can see a little bit on this slide that what type of programs that your employees want is shifting. And then we're also seeing employer groups ask us, what can you do for those other areas of well-being? I understand the need for eating right and exercise, but what else are you offering to support us? So any questions on kind of trends or anything that you guys want to go into before I talk about how our services match to that? Okay. So when we actually sat down with Nancy and reviewed this information, we try to be proactive. We also get questions on what does Wellmark offer. And so at Wellmark, again, keeping those trends in mind, we offer, which is on slide, or the 4th slide, we offer services in 2 different buckets. The first one being consulting services. So when you think about many of our employer groups, knowing where to start, having the hands or the staff to do it is often a concern. Most importantly is when you think about why you do wellness, it's important to consider, sometimes we do it off the side of our desks, but then we're expecting some goals, meeting goals and objectives. And so many of our employer groups say, how can you support us? So on the employer consulting side, if you see the first one, it's called a workplace assessment. So this is a service for groups that don't know where to start, but we've also done it for groups that are far down the road with wellness and need to rethink about their strategy. This service is a 4 to 6 month service where we're working collaboratively with the staff at the employer group to understand not only the data that we have, so data from the medical plan, dental plan, anything that we have, along with data that is at the work site that can impact overall well-being. Disability, staff guides, we do surveys and focus groups to understand what employees want, what they might need, how they're feeling in the workplace, and we put together a 3-year plan. This plan is then presented to a group like you to look at and hear our recommendations and then prioritize the recommendations to help set the tone of moving wellness, or you'll hear me say well-being most often, move that forward in the organization. That is a very concentrated service. Again, the goal of that is a 3-year strategic plan with how you improve not only workplace culture, but also just the well-being of employees, how they feel at work. The second one is hourly consulting. And so I mentioned having hands, being able to do things. We have many groups that reached out to us and said, hey, I have this wellness program, but I don't have the time to get communication out, or I have a wellness team. I need help delivering that or facilitating that. So we have many groups that purchase hourly consulting to help us do something. So, and how we get to that is sitting down with a group and saying, tell me a little bit about where you're struggling or where are your barriers to your wellness. And then we put together a proposal for that. So you'll see our staff going out, and I manage a wellness team. to help drive ideas and get energy in the organization for a company in Des Moines, well, actually a couple companies. This service is very customizable, and it's based upon sitting down with the group and understanding the needs and putting the recommendations together. We also added in recently a culture survey. So when you look at research from why do wellness, what impacts the overall health and well-being of not only an individual but a company, the culture is really important. And I'm sure you have seen some of the research and articles that are out. But we were getting that question a lot, and we added in the ability to help a group administer a culture survey. So we partnered with Salvio Partners, which is a large group that works specifically on employee engagement and culture, and actually our team is certified in this by this organization. And we work with organizations to deliver a culture survey and then report out on the results and give them recommendations on next steps. Any questions? That was really high level about the employer consulting, but hopefully you get a feel of we've staffed appropriately to understand all of these dynamics and support employer groups no matter where they're at. Moving to the right is the well-being services. So this is often why we're brought in, to be quite honestly. An employer group knows that they want to offer some type of wellness or well-being service. And so we do currently, we are powered by WebMD. So when you think about traditional wellness, and again, I'm going to say well-being services, you're talking about an online wellness center, health information, challenges. So, a team-based activity challenge where you might work against other departments to be more active. That's kind of what people typically think of when they think of wellness services. How we package and sell it, if you look in your handout behind the PowerPoint slides, there's a nice brochure. I think it's called, let me just switch to it real quick. It is behind the employer consulting and invest in employee well-being. So this is a real nice overview of these services. I always go to the last page, which is page 4. We call them packages. But how we sell those services is very dependent on the employer group's needs. And I should mention, when you think about wellness and well-being services, there's lots of options. We offer different levels. I think where we are different and what we pride ourselves on is working to understand you as an employer group, spending time with Nancy or other staff to understand needs before we recommend services. But we want to make sure you see these. These are, you can kind of see on the left-hand side is the different, different things that each package offers, and then the check correlates to which package it falls into. Along with these services, not only understanding your needs, but also designing how these are implemented in your organization. So, and that's the support that our team provides when we start working on these services. We also offer add-on services, so biometric screenings, on-site screenings. Hopefully you've heard some employer groups offer. They want to give their employees an opportunity to understand their blood pressure, their cholesterol. Before making a recommendation for an employer group to do something like this, that's the benefit of having your medical plan data. I always look at how many people are getting routine office visits. How many people are not seeing a doctor, because sometimes that point of need information can be really beneficial. Now, looking at what we've shared today, I know we're going to get some follow-up information, but it is very dependent on employer groups. If an employee has an opportunity to go to a doctor, they have plenty of time off, and there's no barriers in place, I typically may not recommend that unless I see a need. But these services can be added or taken away based upon what we know about your employees and members. We also offer coaching. So we offer, this is telephonic coaching, again powered by WebMD. So for lifestyle factors that impact overall health, and also the tobacco cessation coaching is very specialized. It's a specific program designed to, when a member's ready to quit, and then it's a 12-week program and then followed up by, we follow them through to make sure that they stay quit. And we also offer debit card redemption, because with wellness programs, oftentimes there's incentives in place or rewards in place to get them to do what maybe the group thinks is important. And so we offer that all combined in one area. These are not, you don't purchase them all. It's based upon what we together would decide would make sense for your employees based upon needs. So that was a really high level of our services, but hopefully you can get a gist of knowing that we did see a need. We understand employer groups like you want to keep their employees healthy, but also want them to feel good when they come to work, because there is something about, I care about you, I care about the things that you're doing to keep healthy for your family and also for the workplace. Any questions? I want to end on just some thoughts for you. I have lots of information should wellness be something that you want to do or you want to consider. When people or groups don't know where to start, I try to make sure that they know kind of next steps. Anytime you want to implement a wellness or well-being program, you really got to understand your goals and objectives. So whether it's to attract and retain top talent, it's to just have some fun in the workplace, those are really important, because when we work with groups, then we want to define what measures we're going to share with you each and every time we meet. And sometimes that piece goes by the wayside, because wellness is historically, people think of it as fun in general, but then in the end, we want to show what we're measuring. So my recommendation to any group, and a group like you, is to think about, if wellness is important, why you want to offer it, so we can help you measure that why. We of course have services, and you can see the services to the right that can align with that certain area, although many groups do. So the Beacon package, or that workplace assessment, is something that where we help people come up with their goals and objectives, and we define what they're measuring. But some groups just do that on their own. They sit and then they come to us and they say, we want to offer this, and here's our goals and objectives. So then we can align our services and then the measurement of those services moving forward. So that leads into number 2 on that last slide, which is slide 5. That helps us, your goals and objectives help us determine what you want to offer. So is the wellness package the right thing for you? So you can see, I know when we talked to Nancy, that was one of our things, is what do your employees want? How do they feel? And we actually talked about, is there a survey, or is there a way to capture that information to help you move forward? So not only the goals and objectives, but what your employees want is an important consideration. And then last but not least, then we create the plan. And hopefully you've seen that at Wellmark, we've set up our staff and our services to support each step along the way. But a lot of it is guided by the discussion that you will have on if it's important.
One question, on your last page, your packages, do we have a cost for each of those 3 packages?
Yep, we can offer a cost for all. I brought just one of the initial things that we talked about. So if you look at that back page, Activate is kind of the base package. And that is a package that offers that robust wellness center, a wellness assessment, tracking, messaging to employees if you want to encourage certain things. Many of our groups that are not offering wellness, that's where they start. And one of the things that I've heard today in the medical plan, a lot of it is their program centers around getting them to get a routine physical. At Wellmark, we can track and reward credit to anyone in this wellness center that does that, because we know getting a early detection and getting a medical home is important. So that Activate package for your group, it's $6,000. Each package goes up just a little bit. I brought one price to your question just because I wanted you to get a sense of what it is. But again, I think understanding if wellness service as a package is the right fit for you is a very important discussion, because you gotta know why you're offering it, and we need to set those goals and objectives.
So when you said earlier, you mentioned when you were going through that actual consulting services,
Yep.
you said the workplace assessment was gonna take 4 to 6 months of intense goal
Yeah.
setting and whatnot. So how does that break down to, say, do I start, do you go into departments, do you start getting, that's also gonna be an added cost for us from taking staff away from the actual work.
You're exactly right.
So, do you have a number that you can quantify for us to be able to say, okay, it's gonna take us another 200 man hours per year? Because then that $6,000 obviously goes up substantially from our
Yeah.
perspective.
And the 6,000 is not for that intensive review. The intensive review is 12,000 for your reference. This is for an online portal, the 6,000, so just keep that in mind. The Beacon package, and I know there's a lot of information in regard to that. We have that process, I have a step-by-step guide to that process if that's of interest. On average, it's about 30 hours with someone like Nancy over the course of that 4 to 6 months that I would need of her time for meetings and review. As far as other staff, for a survey, we do a survey with all staff, and then we try to do 1 to 2 focus groups, one for employees where we invite just a subset of them, and one for leaders, anyone with direct reports. So the survey will take about 15 minutes of each person's time to complete. It's a short survey. And then the focus groups run about an hour, but that wouldn't be with all of your staff. Outside of that, the rest of that time is work that we're doing to review all your data. So we try to limit the staff's time, but recognize that, completing the survey and getting that communication is part of it. And then it does require time, probably, I'm gonna make it a guess, of this group to do a facilitated activity with us to help prioritize what we found in our review. So 4 to 6 months is a range. Many are completed within 4 months, but it depends on the leadership schedule. So we have a full board of directors that we did this with, and it took us like 6 to 8 weeks to get on their calendar for that 2 to 3 hour activity. So that's why the range.
Okay. Well, if you could just get us the information on the cost for all of those, and then
Okay.
what your man-hour times would be from a staff perspective, for us to be able to review that.
Yeah, I think that to me, that's about the investment. What's my startup cost, and then what's my annual investment look like? Yeah, you get a rate of 6,000 for the city, but there's other items. Staff time, what typically is, and we understand without looking at the specific group, you don't get that. But if we invest how much, what do we look at? What are we looking at? And I believe in wellness programs. I think a lot of us, most of us, have never been taught proper diet, proper exercise, those kinds of things. And I think it can be helpful to people's lives more than just work. It's all outside of work. So, but it comes at a cost, and we have to be planful about that. So I'd like to see, kind of like Santos said, kind of what's the startup cost look like? What's the annual operating of a good wellness program?
And
Okay.
one last thing I guess I want to chime in on is, you mentioned incentives.
Yep.
You mentioned items that, if we were to do this, there would be an incentive for a cost. And I don't know how that actually comes into your wellness. I mean, where does those funds come for that incentive? Is that paid through our annual fee, or is that something that comes out of Wellmark's? Where does the bucket of money to pay that incentive to that individual to say, hey, go get your biometric, testing done, go do this, go get your physical done. There's a $25 Amazon card. I don't know, whatever it may be. I'm sure there's different wellness programs that offer different incentives, but who actually funds that incentive program is what I would like to see on that
Yep.
program that you're providing.
Yep, so all of our groups that purchase our services, they fund the incentive program. So, we give recommendations if you want to do incentives based upon what we know, we see in the industry. For example, we know there is a certain threshold in incentives that you don't get any bang for your buck as far as participation. So we help consult around them, but that funding does come from you as an employer group. And not all employer groups offer incentives. Sometimes they just wanna have fun at work and I want a wellness program, so it isn't a requirement.
So, and this is separate and distinct from the blue distinction, process, right? Okay,
A lot of information.
I know, it is. Thank you.
I'd like to go back just a little bit. I was thinking about the program where the doctors will contact the individuals and recommend certain, like annual checkups or whatever the case may be, that, what kind of participation percentage would one expect if you've got a group of 400 members, let's say? You know, because I know how people are in regard to just doing, say, annual checkup, something that simple. And there is many excuses, much resistance just from humans to do something so simple as that. So my curiosity is, what would one expect? What kind of success would that group expect with, say, a group of 400 people? How many, I mean, I don't know what the track record would be on that.
So I just wanna make sure there's a little, so in wellness programs, cause some of it falls under the ACO, so I'm gonna speak about wellness programs. Many of our groups do say, one of the most important things I want my employees to do is go to the doctor and get their annual exam or their health maintenance exam. And so that is often built in to their chosen incentive program, so or wellness program. So when we track that, so we're managing that. So if you're on the health plan, I can pull and mark you down as completing your annual exam when certain codes come across. What we found is there's a couple of variables on the uptake of that. Number one is how much communication and time is the employer group putting in to encourage that? Because at Wellmark, we can encourage it, we can, if you're in the wellness center, I can message to you, but it also needs to be messaged from the employer group that this is important to us and here's why. The other thing is, there is some dependency on incentives, because to your point, sometimes the only thing that's gonna tip someone over is maybe the chance at getting a $25 Amazon gift card. So an employer group choosing to offer incentives but also communicate are important factors in there. One of our largest groups, they have about 90% that go to the doctor and get credit for doing that. They are highly communicating that, and there is some incentives behind it. I have another Muscatine group that we're about 40%. They offer incentives for that, and we're just now working on ways to communicate and encourage it better, because the only communication, or the communication today, is limited to what I can send out from the wellness center. So there is a lot of variability. Some of it hinges upon making sure we communicate and we're encouraging it, and then we're supporting on the other side to think of ideas on how to get it to be as important to them as it is to you. Would you add anything from the ACO perspective?
I think that pretty much covers.
Okay.
I think 40% is a great number.
Yeah.
You know, I don't know how you'd ever get to 90.
You wouldn't believe the communication
You're right,
and the energy, I know. But there's some factors too, and I don't wanna, I mean, when I'm looking at groups, highly female groups, I mean, there are some people that, I don't wanna stereotype, but there's just by nature, as a female, I tend to go to the doctor more than a male. So my goals are always dependent on what's going on in the group. We're working with your account manager to say, right now, your annual exams are at this %. So what's our goal for next year and how are we gonna get it?
Sure. Very good, thank you.
Thank you.
Thank you guys very much.
yeah, a lot of information, thank you very much.
Alrighty, item number 8 is discussion and possible action to approve the minutes of the June 3rd meeting.
Move to approve?
Second.
And moved by Jeff, seconded by Santos, all those in favor?
All right.
Item 9 is correspondence. Santos?
I don't have anything other than the email that was sent from Doug in regards to trash and recycling.
Sure. Jeff?
Had a meeting this last week, a group with, folks of the drainage district, couple of municipalities. I think everything went well and working on plans to move forward. I also met with the interview team for the, Muscom management position, the MCC JCC team. They reviewed all the applications, and I guess basically, in a nutshell, they made a recommendation to the commission that they appoint Chris Jasper, who has been serving as an interim manager since the change to the permanent manager. So, and that was it.
I was also at the drainage district meeting, would echo Jeff's sentiments, I think we all received that same, email from Doug that he was forwarding that Santos mentioned. Also had a communication from, resident of the county early last week about, complaining about a county employee. I, addressed that with the county employee's supervisor, so. That's about it. Scott?
I have nothing.
Doug?
We had Wednesday, June 5th safety meeting, and the email that I got from Claudia on recycling concerns.
Does that include your committee reports then?
Yes.
Awesome. Scott, committee?
No committee.
Okay, yeah, myself, other than that, drainage district meetings, no committees. Jeff?
On the 4th, I had the Regional Workforce Investment Board in Davenport. Still kind of in flux.
Santos?
No committees.
Alrighty. Item number 11, receive information from county employees. You got some math for us, Keith?
Yes, I did. I checked the numbers and they all checked out. So
I would move to approve Peterson contract, awarding to Peterson Contracting Inc. 209,936.50.
I'll second it.
Jeff has moved to award to Peterson's Contracting. Santos has seconded. Any discussion? All those in favor, aye, say aye.
Aye.
All right. Wonderful. Any other county employees? Okay, items, 12, items with the administration office. First, we have discussion and possible action to approve the reappointment of Jody Royal Goodwin to the Veterans Affairs Commission for a 3-year term ending June 30th, 2022.
I move to approve.
Second.
Scott has moved, Jeff has seconded. All those in favor?
Aye.
Item B is discussion and possible action to approve the appointment of Michael Calvin to the Veterans Affairs Commission for a 3-year term ending June 30th, 2022.
I move to approve.
Scott has
Second.
moved, Jeff has seconded. All those in favor?
Aye.
And item C, discussion and possible action to approve the appointment of Paul Elshoff to fill a vacancy on the Civil Service Commission for a term ending, this is just a 1-year term, Nancy, is that correct?
This is filling a vacancy.
Okay, to fill the to fill a vacancy, ending June 30th, 2020. All those in favor?
Aye.
Okay.
I need a motion. You
No.
need a
No,
motion.
so-
I'll make the motion.
And I'll second.
And
All
Scott will
right,
second.
Jeff has made the motion, Scott has seconded. All those in favor?
Aye.
You guys, keep me honest here.
Yeah, that's right.
Thank you to everyone who's volunteered to serve. We appreciate it greatly. Is there anything else, Nancy?
I don't have anything else.
Okay, anybody else have anything?